Welcome to our informational meeting with St. John's regarding the community health and SEIU 2015 IHSS Caregiver Partnership. I will be passing it over to Ms. Ann Milton. Ann?
Hello, everyone. I just want to make sure that everyone can see my screen. Farah, can you see my screen?
Yes, I can.
Okay, perfect. So I'll get started. Hello, everyone. My name is Ann Milton. I am the director of CalAIM here at St. John's Community Health. CalAIM is a case management-based program. So today I'll be giving you all a little bit of information on CalAIM and how we need your help. Just a little bit about me. I'm a registered nurse by trade. I've been in healthcare for almost about 14 years. I oversee a team of 50 case managers. And here today just to speak to you all about the help that we need from you here in LA County and here at St. John's Community Health. All righty, and so our agenda is up on the screen today. I'm gonna speak to you all a little bit about, give you an introduction to St. John's Community Health, the purpose of our partnership and the goal, and a CalAIM overview. Let's see. And so St. John's it started off as a one volunteer-run pediatric health clinic in 1964. And today, we're one of the largest FQHCs in LA County. We serve patients of all ages at over 20 locations, including standalone clinics, mobile clinics, community-based health centers, school-based health centers, and we have about 15 clinics here in LA County, 2 in Inland Empire. We have 7 school-based health centers and 3 mobiles. We offer services such as medical, dental, vision, behavioral health, and different supportive services at all of our locations. So I want to get a little bit into the purpose of our partnership. Often our case managers are faced with patient concerns where we have consumers. I'll call them consumers today. We call them patients here, but I'll call them consumers today. So our case managers often find that many of their consumers are in need of in-home supportive services, but they lack the social support, so they don't have the family or the friends that they would need to be able to hire these supportive services. And so today I'm asking you to really look and see if you're in need of more hours, if you're in need of more consumers, and can help us out with that. Farah, do you want to go ahead and launch the poll?
Yes. So to get a better understanding of the needs everybody has on the call, and once again, thank you for joining, I'm going to be launching out a series of poll questions. Answer each poll question as they come, and I'll help us be able to help you better and also make sure that everybody here gets the most out of this training. So I'm going to go ahead and launch out our first poll question. So everybody on the screen, this is the very first question we're asking, as if do you work fewer than 264 hours and would like to pick up additional hours within the LA area? So everybody, you see the question in front of you. If this is something that you're interested in, please, so that we'll be able to help follow up in the future, answer yes or no. And we'll go ahead and give people some time to answer this first question. Thank you very much. Again, you should just see it on your screen. If you have a phone, it should pop up on it. You want to click yes or you want to click no, okay? To the question. I see folks are still answering, so I'll give it about just another few moments here.
I think that I accidentally put the wrong answer.
What was your name, sir?
Edgar Charles.
Edgar Charles. Could you leave that in the chat, please? Just say, I wanted to put yes for question 1.
Okay.
Thank you. If that was any other person situation, but I do see most people were able to vote. And we do have a few other people who haven't participated. Again, if you're having trouble, maybe just leave it in the chat. The first question was if you were interested in, if you have less than 264 hours and like to pick up additional hours. And if my co-host could help me, please let people into the meeting room as we're talking. So I'm going to end the poll now and we'll move on to the second question. So the second question is, this is for your consumers, for your clients, the patients. Do you spend a lot of time coordinating
Hello.
appointments for your consumer and need help?
Sí, buenas tardes. No sé cómo ponerle para español.
If our translators could help translate what I'm saying, and if you were not able to click on translation, please click on the globe button to select your language. And necesito translation and in
Si hay un
Español.
intérprete que puede ayudar en español para explicarles a las personas cómo agarrar el lenguaje en español, por favor, háganlo ahorita. Gracias.
Thank you, Vanessa. Again, the question is, do you spend a lot of time coordinating appointments for your consumer and need help?
What if you don't need help coordinating?
Como para la primera pregunta, ¿me la pueden decir en español para poderla contestar, por favor?
Then put no. But they only give you one option and it's yes.
The
Voy a
option,
meter la pregunta en el chat, ¿ok? En español.
yeah, so Talita, there's a no button, so there's a yes and a no. So if the answer,
Okay.
if you have a no, then it should be no. Okay. All right, let's move on to the second question.
I
What is the third
couldn't
question?
answer the second question because for me it only showed yes.
Then if it's a no, then that's all right. It should just be an affirmative answer. If it's a no answer, then it's okay.
Yeah,
But
but I
no
couldn't
option.
press anything.
Yeah, so just check on your iPad, but leave it in the chat what your response would be.
Okay. But I can't. Okay, I can't go back to that.
No, you can't.
Uh,
We're moving forward. So if
okay.
anybody on the call
Okay.
has anything they'd like to add, please add it to the chat. Thank you. Now let's go into our third question, which is, are you concerned that your consumer is not getting the best care? Again, everybody, please bear with me. The options are on your screen. It is a yes or no question. If you are not able to see the no, it's all right. But it's more important for us to be able to get the yes. Okay, so if you are not concerned with this question and you do not see the no button, there's no need to type in no. But if this does impact you and you would like to respond yes, and please do so now. Again, these are for our consumers. So if you're concerned for their care and they're not getting the best care, then please respond and either affirmatively or no. So yes or no. And again, if folks could please go on mute, we will have opportunities later on, so that we can make sure everybody can participate. All right, I believe everybody was able to record their answer. Okay, Thank you all. We're gonna go into our next question.
1 second, Farah, I'm sorry. There's a lot of folks saying that they're saying yes, but to the chat. If you say yes, you have to press on the in front of your screen where you see the answers, please press yes or no. But if you're putting that on the chat, we won't be able to capture your information.
Okay, thank you. Most people I think are repeating, so if you put yes on the question, there is no need to put it in the chat, only if you are not able to see it. Now, the next question I see people already responding is your consumer at risk for getting into a nursing home? Are you worried that they might be placed into a nursing home? That is the question that we have now. And again, if you have answered on the screen, there is no need to answer on the chat. The chat is only if you are not able to answer the question.
Me da opción para hablar, para decir need the one question.
Vanessa? What was
Please show me the screen. The question number 3.
the question number 3 is gone. If you, the question was asked if you're worried about your consumer's care, and if the answer was yes or no, you could put it in the chat. But we are on question 4, and most people are answering it right now. Again, we'll be able to follow up with folks, but we just want to give everybody the opportunity and also make sure we're able to go through the rest of our training agenda for today.
Show me the screen.
The screen, it's on question 4 now. We can't go back. So
Question.
okay, I think most folks are able to answer question 4, so we are going to move on to question number 5. This question is, does your consumer go to the emergency room often for asthma, recurring UTIs, or another chronic condition? So do you find yourself having to go with your consumer, or your consumer going to the emergency room for any of these type of conditions or other chronic conditions, asthma, UTIs, other conditions they might have that require many emergency room visits? Again, these are questions for you consumers. Please answer these questions. Do not stress out if you were not able to answer a question. Okay, there will be some follow-up that happens after this meeting. We are trying to get a sense of what the needs of folks are.
Okay, I'm on the phone and it's not popping up. So will I be able to redo it once this is over with for the questions?
Again, I don't even see your name. You're just coming up as a phone number. I'm assuming because you're on the phone. But if you, I don't know if you can type in anything at all in the chat.
No, and so will I have that opportunity?
Yeah, we'll have some sort of follow-up, yeah. But
Okay,
everybody registered, so you provided your contact information, so.
Okay, well, anyway, I'm Sharon Burton, so, and I did. Okay, thank you. How do I unmute?
I got you. Thank you. All right. We are going into our 6th question now. Thank you everybody for participating. We are almost done here. Our 6th question is, your consumer being evicted, couch surfs, or is housing unstable? Are you worried that your consumer is about to lose their house or have housing concerns for your consumer? This question is for that. And again, I see some questions. Again, these questions are to help gauge situations for folks. But again, there'll be a follow-up. So thank you folks for continuing to answer. I'm just monitoring the polls at the moment. Again, if you were able to answer the question in the chat, I mean, if you were able to answer your question in the poll, no need to answer it in the chat. So just please put it on the poll question. Okay. We are now going to do our last question here. And this is the last question we have for folks. And it's regarding, again, your consumer. Have they been recently diagnosed with cancer?
Farah, I'm not sure if you gave everyone access to the slides, but it looks like someone's marking on the slides. Are you able to erase those? Because I am not.
Yeah, I'm not sure how they're doing that, but I'll try to take care of it right now. I'm not sure who has access to the slide.
It looks like that feature is available for everyone, all of us.
I'm trying to erase that on my end, but I can't erase. Oh, Lord.
Okay, give me a second. And do you want to like maybe unshare your screen and then try to reshare your screen? So
Okay.
Okay.
Okay, there we go.
Okay, and I believe I turned off the ability to do that. So okay, and then that would brings us to our last poll question. Thank you everybody for answering and participating. I will be handing it off to Anne to continue the rest of the informational training that we're going to do regarding us. And it's going to include, I'm sure, information on what was just asked to folks. And again, everybody was able to register and you provided us with your contact information. And hopefully this is a program that will be beneficial for everybody and also for their consumers. So thank you, Anne, and I'll pass it to you.
Perfect. Thank you so much. Thank you everyone for answering those questions. That'll be helpful. And so again, the purpose of our partnership is to collaborate with you all. We want to provide patients with a directory of IHSS workers who need additional hours. So the goal here is to have a directory with your, and I'll show you what the directory will look like. It'll have your name, the amount of hours you already have, your availability, so that our patients here at St. John's will be able to go on that directory, see who's available before they apply for the IHSS service through the state. And so I'm just going to go over a little bit about CalAIM and the type of patients that we have in the program. And so when you hear CalAIM, it stands for California Advancing and Innovating Medi-Cal. What this is Department of Health Services is transforming Medi-Cal for their members. They want to make sure that it's more equitable for members, it's coordinated, and it's a seamless process. I don't know if you all know of anyone who's on Medi-Cal or on Medi-Cal yourselves, but sometimes it can be a tedious process, following up on referrals from your PCP, even at minimum knowing who your PCP is. And so our program handholds and walks the patients through this process. That's what the case managers do. And so this is a Medi-Cal benefit. It is not something that the consumers have to pay for. It is a Medi-Cal benefit. And as long as patients are eligible, they can access this benefit. So what we need from you all is to, if you are available, if you do have hours available, to add your name to the directory so that when our case managers come across patients who need IHSS support, we can go to the directory and hire you all as the caregiver before we send the application off for the patient. And let's see. And so some of the goals for CalAIM are to identify and to manage the needs of our patients, our Medi-Cal members. We want to improve quality outcomes for the members by reducing health disparities. And we also want to have a consistent and seamless Medi-Cal process for our patients. Some of the benefits to the consumers would be outreach and engagement. We'll do enhanced coordination of care, chronic health condition education, hospital discharge planning and coordination, also housing navigation support. And so the CalAIM programs that are here at St. John's consist of our community supports program, which is a housing case management program. And then our enhanced care management program is a medical and a non-medical case management program. Our community supports patients receive a housing case manager who can provide homeless and housing services for those members. And so our housing transition navigation service are for patients who are couch surfing, at risk for homelessness, or homeless living on the street. And then we have our program, our housing tenancy and sustaining service are for our patients who are the different patients.
And could you just give me a second? I'm gonna mute everybody.
No, you put your phone on mute. Wow.
Oh, I think you muted me. Okay.
There you go.
Can you all hear me? Perfect. Alrighty. Again, our housing navigation program would be for consumers who are at risk for homelessness. Examples would be couch surfing, they've received an eviction notice, or they're behind on rent. We can assist with that, with those services. Our housing tenancy services would be for consumers who were homeless in the past 12 months and who have recently been housed and need help with basically staying housed. A lot of our patients who were homeless on the street and recently housed fall back into homelessness. And so our purpose in that program is to prevent them from experiencing homelessness again. We have our housing deposits program and our asthma remediation program. Our asthma remediation program would be for consumers with uncontrolled asthma who need financial assistance to modify things around their homes that's causing asthma triggers. For example, if they need new carpet, if they need the fireplace to be cleaned out, if they need air purifiers, pest controls, things like that to mitigate the risk of having asthma attacks. Let's see. And our enhanced care management program is a medical and a non-medical case management program. The consumer would be assigned a case manager who would provide intensive whole person care to address the patient's needs. So things that the case managers can assist you and the consumer with is chronic health condition education, referral to different community and social supports, hospital discharge coordination, preventative care referral follow-up. So if you have a patient who goes to multiple specialists and it's just hard to keep up with those different appointments and remembering when they are and how the patient's going to get there, the case manager would set those things up, would set up transportation via the health plan, would make sure that the patient is attending those specialist appointments as well as primary care appointments. Treatment adherence monitoring, and then also appointment follow-up coordination. And so what we need from you, we're almost done, guys, so sorry. What we need from you is your time and your referrals. And so when I say your referrals, if you have a patient who you feel could benefit from an extra support and could benefit from a case manager, you and that case manager could work together. Obviously, you're there with the patient on the ground, you're in the home with the patient, and then you'll have that extra support from the patient's doctor's office, basically, someone who can help guide you through their healthcare. If you have any patients, we would love referrals. Please send the patient's name and contact information to Sherry Avella, and she'll be able to complete the referral form, get it over to St. John's, and we'll reach out to the patient. When you let Sherry know who the patient is, let her know what's the best contact information so that she can add that to the referral form and we get in touch with the correct person on the patient's end. And then if you're looking for more hours and you're willing to be assigned additional consumers, please reach out to Sherry so she can add your name to the IHSS directory. I'm hoping that we can get names on there as soon as the end of the week so that we can present this to our case managers. We have a lot of patients who need the IHSS service and they just don't have the support. They don't have the community or social support that they need to be able to hire those folks. And so here's what the referral form looks like. This is more for Sherry, but due to confidentiality and HIPAA, we will make sure that you reach out to Sherry and she'll complete this form for your consumer if you want to refer them into either of the programs, and we'll get this form and reach out to the consumer. And so the workflow for the directory would look like the caregiver would identify patients who need the IHSS service. They go to the directory, find someone that's closest to the patient, like in the patient's, close to the patient's home or lives somewhere near the patient's home, or add it to the directory that they're willing to travel to where the patient lives. The care manager would present the list of candidates to the patient, and once the patient selects the IHSS caregiver, the care manager would assist in setting up interviews with you all, and then also with the application and assignment completion. And so I wanted to, let me see if I can stop sharing, or yeah, let me see if I can stop sharing so I can show you what the directory looks like and what information would be added to the directory if you were to decide to add your name on it. 1 second. Okay, let's see. Okay, I am going to want you all to be able to see my entire screen. So. Alrighty, are you able to see my screen, Farah?
Yes.
Okay, perfect. So here's what the directory would look like. We'd ask for your name, the ID number, if your gender, your race, ethnicity, phone number, email, the language that you speak, your availability, your current hours. And so we would also ask where your home location is. And that's basically where you, where you are stationed now, like where your home is. And if you're willing to travel, and if so, which spas are you willing to travel to? And so when I speak of spas, I'll show you this map here. This basically says where you're willing to travel. And so many of us, or most of us, are in spa 6 and in spa 4, or willing to travel to spa 6 and spa 4. We're opening it up only for right now to spa 6 and 4. So if you're willing to travel to spa 4, but you live in spa 6, you can go ahead and add that to either section. We are not working outside of spa 6 and spa 4 at the moment. But if you are a spa 6 provider, which for spa 6 would be South Los Angeles, and spa 4 would be like the metro Los Angeles area. So we'd ask that you, if you're willing to travel you go ahead and add the spa that you're willing to travel to. And then also the best time to contact you, our case managers work from 8 to 5. So most of the time they're on the phones earliest in the morning, but whenever you're available, please add it here so that the case managers know what time is best to contact you. I am going to all righty. And so I just wanted to put up the questions that we asked you in the poll again, just to get you kind of thinking about the type of patients that we encounter here in CalAIM and what you're looking for, the purpose of you coming to this webinar. And so if you do work fewer than 264 hours, please add your name to the directory. If you notice that you're spending a lot of time coordinating care for your patients, or you feel like your patients are not getting the best care, they may be at risk for entering a nursing home, you feel like your consumer goes to the emergency room often, has multiple asthma triggers, maybe even recently diagnosed with cancer, or has unstable housing, these are all patients that you can refer into, all of your consumers, that you can refer into our program as well to get them that extra support. And so I know that there are a lot of folks on the call. So I don't know, Farah, do you want me to open it up for questions? Do you want maybe to have everyone add their questions to the chat, and then I can do a Q&A and we can send it out to folks?
I think we can do maybe a couple questions, but everybody else, if you could ask your questions in the chat, I'll open it up for a few questions. Just for the sake of time, maybe we can do a few.
Okay, no worries, we can do that.
All right, so this is how we're gonna do it, folks. Please raise your hand, and then as you raise your hand, I will unmute you. Okay.
Yes, Farah.
Go ahead, Mary.
Yeah, I put the question a few times. Could you please put the link to that questionnaire for the consumer to fill up? If you have the link, that would be very helpful. Just put it in the chat so that we can open the document.
Do we have that link, Anne?
I can put it in the chat, but what I believe we wanted to do was have Sherry. I can put it in the chat, and then they can be sent in to
Then I
Sherry.
can forward it to Sherry.
Okay, I can do that.
Yeah.
Let me go ahead and I will add it to the chat now. Oh, we can go to the next question while.
Okay.
Mhm.
Thank you. All right. Next question would be for Morgana Hall.
Hi, everyone. When I was filling out the information or answering the questions, I didn't answer some of them correctly. Is there a way to go back and change that, or should I wait until I go into do the update?
Again, I think
that's
right
what-
now it'd be best if you're interested to email Sherry or fill out the link. So then
Okay.
you can answer. You can email her with how you would answer those questions. Sorry if I answered your
Okay.
question, man.
No. And then
No,
I have
no,
one more question. If I have a consumer that do not want to be involved with anymore, am I able to pick up new consumers as well?
Yes, if you add your name to the directory and you add your availability, we will have our case managers follow up with you. Yes.
Okay, thank you. And I sent you something directly. I know that there's a lot going on, but I sent you a direct. So I just wanted to know if you could kind of help me in that area where I sent I don't know if you can go all the way back through there, but yeah.
So if I look up your name, I may be able to find it. If not, can you know what? Can you just send it to me directly again? Really
Okay.
quick?
Okay. My name or?
You can send it direct to me and it should come right to me.
I did.
Okay, just now?
No, a little bit earlier. A little bit earlier.
Earlier. Okay, I'll travel through to see if I can find it.
Okay. I can also go ahead and just put it back in, and like right now.
Okay, if you want to put it back in, because I know that.
All right. Thank you.
Thank you.
Mhm.
Okay, thank you. And then again, folks, Sherry provided her email a few times. If the question about adding to the directory, the easiest way is, send an email to Sherry. Sherry, if you just want to maybe spam your email a few times, I guess, in the chat. We'll go to the next question. That would be to Kachatur.
Vishwasat im harțes enavor եզրեմ արսեմ թե եւ պայթ են կարող սկսել այս ծրագիրը եւ իստեր են կարող արձանագրվել
Are you able to say that one for me one more time? Oh, you put yourself on mute.
And I think you need to select English for your translation for yourself.
Oh, I don't even.
Yeah, and you need to select the interpretation for English for yourself as well.
Oh, I don't.
And then but I heard Harry that he was basically asking, when can we take advantage of this program? Can we do it immediately?
Yes, we can. We can do this immediately. We can start to let Sherry know to add you to the directory.
There's a directory. So Kachatur, we can take advantage of it. And then please, the emails are there. Sherry's email. You can go ahead and send your email or fill out the link. Okay. Thank you very much. The next question would go to, sorry if I mispronounced this, Shalani Kamath. Go ahead.
Hi, everyone. My question was that you mentioned on the areas, you said only 4 and 6 at this time, SPA 4 and 6. Would you be opening for other areas as well soon?
It wouldn't be soon. We're going to pilot this for at least 8 weeks before we open it up to other spas. And the reason is we have to find a few other providers in those spas, which we do have. We just want to set up and coordinate it in SPA 4 and 6 first, and then we'll open it up to other spas.
So if I'm in San Gabriel Valley at this time, is it okay for me to request for SPA 3 and they can keep me on the directory, and when there is an availability, they can add me on?
Yes, if you want to, you can add which spa you're available to travel to, and you can see the map to see where you're able to travel to.
I have one more question, if you don't mind. I am a provider for my son who has autism. At this time, they have only allocated me 47 hours a month. And is there a way for me to get those hours increased at this time, or no?
You wouldn't do it through St. John's. You'd have to reach out to IHSS.
Okay, sounds good. Thank you.
No problem.
Okay, thank you. We'll do 2 more questions for sake of time, but if you have other questions, just leave them in the chat. That way we'll make sure to email everybody back some sort of Q&A as Anne suggested. So I'll take 2 more questions, and this is by the order of the questions received. So the next person I will be calling on is Miss Ella Walker. Ella, if you're still there, I saw your hand raised. You can go just unmute yourself, click on the button to unmute yourself.
Okay, Ella Walker. Hello, everyone. I'm driving, and so I wasn't able to put into the chat what area I would want to work in. So in that case, what do we do in that case? Do we just wait and till the end of this particular meeting, and then I tell you what area I would like to work in? You know, the 5 to 4, the whatever area, the LA area.
You would let Sherry know that you want to be added to the directory and what areas you're wanting to work in, and she'll add that in that column on the directory.
All right. That sounds great. Thank you so much.
Thank you. And then our last question will go to Annette Woodley.
Yes, hi. I just have a question pertaining to the directory. Will there be a link sent out to us so that we can, go into the directory and make ourselves available?
So Sherry, the way that we're going to do it now, this may change in the future, but how we want it to be a little bit more structured now. So please just email Sherry and let her know when your name, I guess what we can do is have Sherry send out the components of the directory so that you can send it back to her. But for now, let her know that you are available, that you are interested, and then your availability. So which spots you're wanting to work in and the best time to contact you.
Okay, thank you.
No problem. I have Faru, if you want to maybe do 2 more. I know we have about 3 minutes. It's up to you.
Okay, that's fine. I'll go to
looks like
Diana Gonzalez. Diana Gonzalez, if you can unmute.
Hello, everyone. Yes, I believe it might not apply to me, but I do have a daughter with Down syndrome, and I do need more hours due to a lot of emergency visits and a lot of therapy appointments and whatnot and follow-ups. So I don't know if this is something that applies to me within you guys.
Yes, so please let Sherry know and we can add you to the directory.
Okay, so just email her and then she will follow up with me.
Yes.
Awesome. Appreciate it.
No worries.
Thank you. Next question goes to Angela Harris.
Hello. Can you hear me?
Yes.
Yes.
Okay. I'm a single mom and I take care of one person who's pretty severe, is my dad. So I need to be flexible enough to be with him at any point during the day or night, which I'm fine with. But if I have other clients, that might make it difficult, but I still need the hours. Also, I would need a client who's okay with me having my son with me. So is any of that possible or can be addressed in some way?
I'm thinking if go ahead and add your name to the directory, and when the case manager reaches out to you directly, then you can let them know the different circumstances behind it, and they'll let you know whether or not it'll work out for that patient.
Okay, yeah, that would definitely be good to know. I'm sorry, I don't know where the directory is. Is it just an email to you or?
It's an email to Sherry. So her email is in the chat. I'll find it and throw it in and add it in here again, but email her and let her know that you want to be added to the directory and your availability and what spas you're willing to work in. And she'll add you to that directory.
Okay, great. Thank you so much.
I did see a quick question that I think is important, if you don't mind answering. And
No
if you put, it's the pay is the same as the regular IHSS hourly wage, right?
Yes, that is correct. The pay would be the same.
Okay, thank you. And then we can go to Sean.
Oh, well, I put it in the chat, but basically, I had a consumer who was recently evicted. She's now in the shelter. I talked to her case manager. She terminated the case for 60 days until she can find housing. She's actually in the shelter right now. I tried to help her the best way I can to get her, in the program. And now that I see that I see you guys help people who are in this.
Oh,
Sorry, I was just putting Sherry's email this way. I thought it might be easier. I don't know if Sean, if you're still with us.
Tom, if you can hear me, based on the circumstances of what's going on with the patient, I would say send an email to Sherry and let her know that you'd like to refer that patient into community supports. And we can reach out to the patient so that we can get her into the housing program here at St. John's. I think it'll be beneficial to her. And I see that everyone is asking for a link to the areas. I am going to look that up now and add it to the chat, the link to the areas, to the different spas.
Could you also, okay.
Oh, go ahead.
No, I was gonna say if you could send it to me too.
Yes, I'll send it to you as well.
Okay, and then everybody, this is the email that you should be sending your interest to the directory for. It's sherrya@seiu2015.org if you can't find it in the chat. So I'll take, do you want to do a couple more questions, Anne?
Yeah, we can do a few more. Yes.
Okay. We'll go over to Blanca. Blanca, if you'd like to unmute.
Hi, good afternoon. Sorry I was late to the meeting. I wanted to I missed some of the questions, but I wanted to find out you know, how to get more hours. And is this program is the same as IHSS? Is that because I think I was late to the meeting, so.
Yes, so the program is different than IHSS. So what we're asking is that if you have availability and you need more hours, that you email Sherry your availability so that she can add you to the directory. What that's going to do is have a case manager reach out to you regarding a patient that they're assigned to who needs an IHSS worker.
Thank you.
No worries. I added the link to the chat. I'm also going to send it, I'll send it to you directly for, oh, I don't know that I can. There we go. I'll send it to you as well. So you have it.
Okay, and then
I'm scanning the chat. So Veronica's saying her mom is your mom. If your mom's a patient at St. John's, that's not a problem. If she's a St. John's patient, that won't be a problem at all. If you want to add her into the directory, or if she wants to be a patient in the Callahan program. I'm looking through.
okay, thanks. This is the map again, folks. Let me see if I can zoom it in a little bit better.
And so right now, if you have availability to service folks in SPA 6 and SPA 4, that's our priority net right now. That's what we are piloting at the moment. If you have other availability for other spas, you can go ahead and add that. I can't guarantee that we have patients that we can refer to you, but if you want to add that there just in case for when we open up to other spas, you can do that as well. But right now, the priority is SPA 6 and SPA 4.
Okay, and then the next question would be, we only have like 2 more anyways. It would be for Shireen.
Hi. Just 2 questions there together. If I were to pick up more hours, how many days per week or how many hours per day would I be allowed to work if I have more than one client? Is this a question I really don't know?
If you have more than one client, if you have multiple clients, you cannot do more than 264 hours in a month combined with all your clients.
Okay.
And no more than 66 hours per week combined with all your clients together.
But is there a limit on the hours per day that I could work? And would I be allowed to work 7 days per week?
So you can work the whole week, right? Your social worker, when you pick up a client or for each client, they give you a maximum weekly hour, and it's also in your notice of action, which is the NOAA.
Really?
Yes. Mm-hmm.
So your calendar is between you and your consumers, your clients.
Oh, okay. Thank you so much.
No worries. Let's get down to our last couple of questions here. I believe we have Maricela.
Hi, my question is this similar to the backup program?
I haven't heard of the backup program. If you can elaborate on the backup program?
Sure. So the backup program is through IHSS also, and you had to also register for it. And what that one does is when a recipient's provider can't make it to work, they call you to see if you're available to do the backup for that provider. So it could be like a 1-day thing, it could be a 3-day thing. Just depends on what the recipient needs.
Oh, I see. So this wouldn't be the same for.
This is more of a permanent provider for these people.
Okay. Yes, if you're adding your name to the directory, the case manager will look at the directory, and when their patient needs someone that's maybe in your area, they'll reach out to you so that they can introduce you to the consumer. You all can speak and go from there if it's a good fit.
Okay, great. Thank you.
Thank you. And our last question and our last hand, it goes to Zashwata.
Hi, I was just calling to wanting to confirm that online it states that there is a 360-hour per month limit for the family member exemption work week. I'm just trying to get a clear understanding of what the max amount of workable hours per month are.
So the maximum amount of hours is 283 for one case, 264 for if you're working for more than one consumer. Those exceptions are they're not. I mean, Vanessa, you want to answer that question? But from my understanding, you have to follow very specific, criteria.
So when it comes to, I'm sorry, Farah. So when it is to one-to-one relationship, meaning you're taking care of one client, hours could reach the maximum hours that they can reach is 283 hours only, and if the social worker approves them, right? So even if a client, and I had cases like this before when a client is assigned 300 hours, that doesn't necessarily mean that you can work those 300 hours. If you only have one client, the maximum of hours, if they're approved and authorized, is 283. If you have multiple clients, right? Again, the maximum hours is no more than 264 hours within a month and no more than 66 hours per week with all your clients combined. So it's on a case-to-case basis. But they reach a cap. So a lot of people get confused when they hear 283 on one client. That's only if the client has been authorized those hours. But if you only have one client and that client has 200 hours, that doesn't mean you can work 283. That client was only authorized 200. But if you come across a client that has 283 and they've been approved and authorized, then that's the maximum that you can work in a one-to-one relationship.
Okay, so there is no such thing as a family member exemption program that affords you up to 360 hours per month.
You can, but the exemption is only if your client was, their case was approved before January of 2016. If they've been, if it was after that, it's not there. So that family exemption extension is for anyone, right, that takes care of any family members, which is like children, parents taking care of children, guardians taking care of any children. There is an exemption, but that exemption was if they were approved before January of 2016.
Okay, so it's no longer. And right now it's 264 is the max.
If you have multiple clients, yes.
Got it. Thank you so much.
You're welcome.
Okay, and then this would be the last one. I do see Veronica, you did raise your hand. So Veronica,
My question was, my mom is a recipient for IHSS. Could she still apply for St. John?
Yes.
Okay. Thank you.
No worries.
okay, so what I'm gonna do now one more time is I'm going to share the email. So if folks want to sign up for the directory, if what they heard is something that they think they want to sign up for, please email Sherry at sherrya@seiu2015.org. That's sherrya@seiu2015.org. These are the locations. They are called spas. Currently, they're looking for providers that are working and living in Spa 4 and Spa 6. So that would be the downtown area and the South LA area and parts of East LA, El Sereno, Eagle Rock, Glen Washington, LA, Mid-City, Hollywood, West Hollywood, all the way down to South LA, Athens, Watts, Florence, Crenshaw, Compton. So those would be the areas. This is the email. So it's sherrya@seiu2015.org. Those are the emails, and you'll get some follow-up. Please leave your questions in the chat. We will be sending out some sort of follow-up to everybody regarding that. And we'll make sure everybody's been registered so we do know who's been here, and we'll be able to follow up for folks. Is there anything else that Maria, Sherry, Ann, you'd like to add?
I want to say thank you all so much for joining. Kay, this wasn't recorded, but I can definitely send out the slides. Again, please reach out to Sherry if you have any additional questions. Thank you all so much. And I think this directory is going to be great for our patients. You call them consumers. Thank you so much. I appreciate it. And I'm excited to see where this can go.
Thank you, Ann. And I think it might actually have been recorded. It is being recorded. So.
Okay, it is being recorded. Sorry about that.
All right. Thank you, folks. Maria or Sherry, anything else you'd like, guys? I like that. All right. And then if not, I'm going to be dropping in the chat. We do have a lot of providers on our call today. Again, this meeting was in coordination with St. John's, but this is SEIU Local 2015. We are the union for home care providers. We do have a lot of providers on the call. If you have not signed membership and would like to become part of our union, or would like to re-sign or update on your CAF or Caregivers Action Fund, please click on the link that I just sent in the message. And I'll take you over to our membership form to sign up for membership. Again, we're only able to conduct these type of partnerships. We're only able to continue to work on behalf of our members if we have a strong union that advocates for home care workers and advocates for IHSS workers. So if you haven't had taken the time to become a member of SEIU Local 2015, please go ahead and click the link I just shared. And then once again, I will share the email. If folks are interested in the directory for themselves, this is the email, sherrya@seiu2015.org. Okay, Vanessa, is there anything you'd like to add before we end our call?
No, I just want to really thank everyone for joining today. This was really great information. And once again, like Farah mentioned, we have a variety of folks on this on Zoom today. So if you haven't had the opportunity to sign up with your union, go ahead and click the link. It's really important for us to continue to have resources where we can win, better benefits, higher wages, right? And also continue to work with our community partners to bring programs like these, into your homes. So thank you so much.